Okay, great. I think we can start now. Hey everyone, welcome to today's webinar organized by Good Business Lab as part of Global Evaluation Week 2021. My name is Ishika and I will be moderating today's session. The topic for today's webinar is COVID-19 and migrant workers on misinformation and financial stress. This is the third consecutive year that we're hosting an event as part of the Global Week, and it's been a great experience for us so far. Just to give you a quick introduction about Global Week, Global Evaluation Week is a monitoring and evaluation knowledge sharing initiative being convened by the CLEAR centers with support from local and global partners. It aims to support the exchange of M&E knowledge and experiences as a means to promote evaluation capacity development, support evidence-based decision making, and strengthen development outcomes at both local and global levels. The theme for Global 2021 is Building Back Better, which intends to encourage discussions about the role that monitoring and evaluation can play in post pandemic recovery. Now, before we go into the lineup for today, I'd like to take a moment to introduce our work at Good Business Lab. Good Business Lab is a not for profit labor innovation organization. Our mission is to lead businesses to improve the lives of all workers. We do this by using rigorous research to evaluate the impact of worker well-being programs. What you see here is essentially the project lifecycle of programs at GBL. We focus on developing a deep understanding of the problem using qualitative research and then co-design interventions with different stakeholders. We then measure the impact of these interventions on both businesses and workers using rigorous research methods such as randomized control trials. We strongly believe that research insights should not be restricted to academic papers and should be disseminated amongst a wider audience in order to drive real business action. Therefore, we actively talk about our projects on various platforms using multimedia content. Finally, we focus on scaling up our interventions by testing them in different contexts and, in some cases, translating our research insights into products and ultimately taking these to market. All our projects at GBL are spread across four focus areas. These four focus areas span across the journey of employment of a worker, starting from unlocking female labor, as part of which we design interventions around bringing more women into the workforce, and at the same time, also unlocking previously idle labor for firms. Our second focus area is closing the skill gap, as part of which we focus on both soft and technical skills that workers might need to grow in their professional journey. We also focus on improving the work environment by taking into account both tangible and intangible factors, tangible such as lighting on the factory floor and intangible such as sexual harassment. Finally, we create interventions around placing holistic health at the core of business strategy. This includes physical health, mental health, and financial health. The contents for today's webinar will essentially revolve around this focus area of ours. For today's webinar, the topic is COVID-19 and migrant workers on misinformation and financial stress. And just to set some context, as you all might already know, India went into a nationwide lockdown on 25th March 2020 to 31st May 2020 to control the spread of COVID-19 in the country. The fallout of the pause in economic activities was felt most by migrant workers, who are a very vulnerable population, and their lives and livelihoods got severely affected. To this end, GBL studied the impact of these vulnerabilities on migrant workers by looking at two different aspects. A, ways of minimizing financial stress by increasing uptake of digital payments, and B, by combating misinformation around COVID-19 and alleviating mental health indicators. Next slide, please. For our work in the domain of understanding digital remittance behavior, we collaborated with ID Insight, which is a global advisory, data analytics, and research organization. They believe in using data and evidence in real time within real world constraints, along with tailored cutting edge analysis to maximize their impact. Next slide. In today's discussion, we'll be sharing key insights and challenges from the two studies. We'll be talking about a roadmap to build trust in using digital payments and its impact on remittance behavior. And finally, we'll be looking at a communication strategy to increase information on COVID-19 precautions. Our speakers for today include Smith Gade, who is a senior research and data manager at GBL, Karan Nagpal, who is an economist at ID Insight, and Sashwati Mishra, who is a senior research associate at GBL. Before we dive in, here are some quick house rules. If you're on our Zoom call, please turn off your video and keep yourself on mute. This is just to ensure the decorum of this meeting, but do introduce yourself because we'd love to get to know you. The flow of the presentation will be as follows: 30 minutes for a collaborative presentation where the speakers together will go over the two studies on financial inclusion and misinformation, 15 minutes for moderators' questions, and 25 minutes for audience Q&A. And please feel free to post your comments, questions in the chat box here on Zoom and on YouTube. Next slide. Now I invite Karan and Smith, who will be walking us through the findings of the first study, that is on the impact of digital remittance training on female migrant workers.
Thank you very much, Ishika, and thanks everyone for coming here today. This first set of studies that I and Smith will talk about is, about digital remittances and tying with the today's theme around how female migrant workers responded to the COVID lockdowns last year. This is important because understanding how they responded to the lockdown last year suggests a number of policy options that governments and employers can and should follow for in such crises times in the future. Next slide, please. And so before I explain the studies themselves, just want to set some context on how we started working with this group. This really started at the end of 2019 when we started working with a group of female migrant workers who were working in textile factories in Bangalore. About half of the sample was from Odisha, and about 80, a very large number, 86%, regularly sent remittances home. The one puzzle or fact we observed that we wanted to study more deeply was despite fairly widespread access to smartphones, and despite very large benefits of digital of sending remittances through digital channels which have been recorded in the literature in many countries, most of these migrant workers were using over the counter channels, sort of to send money home, so going to a shop and asking them to send money to their families home, which was expensive, risky, time consuming. And so we wanted to understand why that was happening. And through qualitative research, we concluded that this was driven by, to some extent, not knowing that they had the option of sending the money home fairly easily through these digital payment channels, but more importantly by even if they knew about it, by lack of familiarity and trust with these channels. And so we designed an RCT to build knowledge, trust, and familiarity with using these digital payment channels. This RCT, and I won't go into that in too much detail. We had a presentation on the Global Evaluation Week. Last year. So and it should be out of the paper soon. So but that RCT really used classroom and individualized training to increase knowledge, trust, familiarity with using digital payment channels. So that increased usage from about 6% women use these channels before the RCT. Through our classroom training, we were able to move that number up to 11%, and through more intense sort of individualized training, we were able to move the number to about 16%. And so the really big finding is, of course, that 84% of the migrant workers who had smartphones, they continue to not use digital remittance channels despite knowing about them, despite this training to build trust and familiarity. Next slide, please. And so, one of the key findings of that study was that success was so low and uptake was so low, not because of poor knowledge or lack of trust or familiarity, but because of a number of sort of supply side structural barriers that these women faced in being able to use that digital payment channel to move money from their bank account to their families. And so, during the training, we recorded each step, how many women are dropping off at each step. And so about 75% women in both groups attended the training, but over time, in the next in the 10 minutes of the training, they started dropping off because Their mobile number was not linked with bank accounts. They didn't have enough mobile balance. They didn't have enough space on the mobile phone. Those were the constraints that really prevented a large number of these women from being able to use these digital payment channels. This is important because then those digital payment channels became important during lockdowns when women had to send money home, and everything was closed. And so, those insights came out in our next study, which, if you can go to the next slide, please. So, with the same group, we did follow up surveys. And so, this study that I just spoke about, we did the first survey around December and the end line around February, March 2020, just before COVID, hit India in large numbers. And so, the first lockdown was announced in March 2020. In April and June, we went back to the same group of women and asked them questions about their, remittance behavior, anxiety and stress, and such other aspects through phone surveys. The lockdown was imposed in March 2020, and factories where these women worked were closed for the entire month of April. You can go to the next slide. And so, one thing we found was that a lot of women stayed behind. They didn't go home. So, at that time, there was a lot of news around migrant workers from cities leaving cities in large numbers, going back to their villages. This group chose not to do so. A lot, because the lockdown was enforced with very little warning. A lot of them, a large percentage, was 77%, remained behind in their hostels. Can we go to the next slide, please? And coming to remittance behavior, the lockdown had a big effect on remittance behavior of these women. So amongst those we know who in February were sending money home, regularly sending money home, only 8% sent remittances in April, and 33%, that number went up in May, but not back to its original levels. Only 33% women were remitting money in May. And just to be sure, April was when the factories were locked down, and May was when production sort of started coming back. I'll now pass over to Smith, who will walk us through some of the reasons and policy insights from these studies.
Thanks, Karan. Just to give, there is a question chat box about the demographic profile of the respondents. So these are young female migrant workers. So they work in garment factories and they are staying in the host. What they are earn around 8 to 9,000 rupees per month. So that is the demographic profile. So most of them are migrants. Many of them, as Karan said, come from Orissa to work in garment factories in Karnataka. So what we then asked these women about if you didn't send remittances, what were the major reasons? So in the first round, what we observed was, so they mentioned increased personal expenditure as one of the major reasons for why didn't they send money. And then 22% said that they wanted to save for themselves, and 9% recorded that they couldn't access their regular remittance channels. And that 9% is kind of important for us because these are women who relied on like their families relied heavily on their remittances, right? So this was done in kind of the first lockdown phase. The second survey round, which we did, was kind of end of May, June, where the factories had already been open. So even though the lockdown continued in May, factories were allowed to open in kind of first week of May. So these workers had already started going to work. And here, what we see is very remarkable change where major, I think the numbers are flipped, but the major change has been desire to save money for themselves was a major reason. So that was 47%, and increased personal expenditure has gone down to 18%. So I think the main thing that we can kind of we thought about this was essentially the uncertainty was playing a major role. And then even in the month of first lockdown, the things became scarce and that increased people's expenditures. And that kind of played part where in the May, that kind of increase expenditure part slowed down, but the uncertainty remained. And that's why even though people's remittances increased, a lot of them still were kind of this, due to higher uncertainty, wanted to save for themselves. Like their propensity to save kind of increased due to uncertainty. Next slide, please. So now we did ask them what were they worried about most. So when we asked, we went with the prior, like when we were kind of starting the survey, our prior was, as with a lot of us, where workers would be most worried about, that one of the major thing they would worried about COVID, if factories open, the risk of getting COVID. But what we observed was one of the major factor, like the most important thing they worried about was their employment prospects. So these workers are in their hostels and the factories are shut. So one of the things that they were worried is that what are their employer prospects, and that was the major stressor for them. Once the factories opened in May, this went down from 51 to 38, but we still see 38% being higher. Second, one thing we need to know is these workers were paid in April and May. So even with the payment, they still find the issues. So the next thing we asked was if remittances were important, how did their families cope? And here the things are bit worrisome because 30% of the workers reported that their families had to cut down some of the expenses which they were relied on. So this is something that kind of ties in with kind of supporting rural areas with transfers and government initiatives to help these families. Now, one of the kind of key takeaways for us was like worker preferences matters and employment mattered a lot for them, right? So most of the workers, when factories started opening in May, they started reporting to work, whoever who were in the Bangalore. So that kind of indicated us that employment issues are very important. And then even this kind of relieve in stress. So we did measure stress of these workers, and we saw higher stress in April compared to May. We were unsure, like when we were going back to April and May, when we were thinking about what could be possible outcome survey, we were not sure whether it would come out this way, because we thought if workers are made to come back in the factories, would their stress level increase because of COVID threats. And at least for workers, employment was weighing way more, like more than the COVID risk for them. And they seem to have lower stress level in May compared to April. This could also be like people had 1 month to see COVID not increasing, but for at least working, they seem to be in better mental shape. Though it needs to be highlighted that these workers had their jobs. So these are not the worker stories that were on all our minds, news channels and newspapers, were the informal sector workers. These workers had their jobs intact and then went back to their jobs in May. So one more important thing that is part which we'll stress in the next round is communication. And so even if workers had their job secured, they were getting paid, they still were very highly worried. And this stresses the importance of communication from the employers, where as much as employers can do about resolving uncertainty with workers, that would be very critical to kind of reduce the stress levels and ambiguity for workers. Next slide. So one thing that we see, that how does this experiment can combine. So this is not very robust because our experiment wasn't designed for this, but we do see that workers who part of our intervention were more likely to remit compared to the workers who were not using digital remittances during our February survey. So this indicates that essentially there was some workers, not all, because for in February and in the baseline we did in end of November, beginning of December 2019, the even though people were using digital remittances, the remittances itself didn't change. So it just changed the channel through which people remitted. But if you remit or not, didn't seem to move because of this. But in the time of pandemic, it did seem to move that bit of whether you are able to remit or not. So I think the key takeaway for us was in this kind of situation, digital payments, the flexibility it affords can be critical. And then I think I'll move to Ishika to kind of introduce the next set of experiments.
Thank you, Karan and Smith. Those were some very interesting insights on remittance behavior among worker populations. We'll be taking questions towards the end. We have quite a few coming in on our chat box. I'd now like to request Sashwati and Smith to talk about the second study, which is on misinformation and anxiety.
Hi everyone, thanks Ishika for the introduction. So this paper or this study was conducted by Sadish Thakur, who is an ex-manager at GBL, and our founders Achyuta and Anant. And next slide. So this study was an RCT that was conducted in June 2020, and it went on for the next 2 months. And it was conducted with migrant garment factory workers from Odisha who were either presently working or had in the past worked at the Shahi factories across the country. And literature review around misinformation and anxiety levels indicated that people who were exposed to fake news and misinformation through various mediums like television or even advertisements were more likely to have higher scores for anxiety, and they were also had a comparatively in general more hampered mental health. And that got us interested in understanding what mode of information broadcast is best at delivering information without negatively impacting mental health. And the key findings of our study were that phone calls, like live phone calls conducted, were not just better. I mean, they were as good as any other medium in information delivery, but they were also better at engaging people, and people were more likely to retain this information. Next slide, please. So we started with like 914 baselines in June, and we randomly selected our respondents into 3 arms. So the 3 treatment arms were the 3 different mediums in information delivery. So like 20% of the population were supposed to receive this information via an SMS, and 40% each were supposed to receive this information either by phone calls or by pre-recorded voice messages. Next slide. So anybody who received their baseline survey today were supposed to, they were provided the intervention in the next couple of days, and the endline survey was conducted for them within a month of them receiving the baseline. Next slide. Yeah, so this is just an example slide of the intervention script that we created. In June 2020, WHO had better regulations and mandates and resources around COVID, and for example, symptoms of COVID, which now aren't as specific anymore, but we used those resources and WHO's mandates and information bulletins to create this script. For example, the first bulletin reads out the common symptoms and so on. Next slide, please. We had 2 major outcomes of interest. One was mental health, which we calculated using a 4-item scale. This was all done over the phone, which is why our surveys were also very small. So the 4-item scale had 2 items that measured depression and 2 items that measured anxiety. And the knowledge outcome was an in-house index that we created. The first 9 variables were these binary variables that tested the respondent on whether they knew the symptoms of COVID, and the next 6 variables were on whether they knew about like general information around COVID. So something like if someone is asymptomatic, could they still have the disease or not? Next slide, please. So just some information about the sample that we studied. About 60% of our, 57% of our sample was female. The average age of the sample was 24 years. About half the population had left the job when we conducted the surveys, and this was a part of our recruitment strategy because we wanted to also tap into the migration crisis that was in order that was the case in around June 2020. There was some like really serious misinformation that were present around that time. I mean, 1/3 of the population did not know that cough was a symptom of COVID. Half of the population did not know that fever was a symptom of COVID. And something more blaring would be 13% of the population recommended cow urine as to symptomatic people, or 20% of the population believed that some religions spread COVID-19 more likely. Next slide, please. So on information delivery, we calculated like whether the information was read by the, or like was like what was the content that was read by the person, or heard by the person here, and whether they wanted to repeat this information or not. So we had those options for phone calls and pre-recorded audios, but we didn't do that for text messages. So all in all, phone calls were more likely to be engaging, like I said in the past. So people were more likely to hear they were more likely to hear the information when it was provided over a phone call. They were also more likely to repeat the information when it was provided through a phone call. Next slide, please. We're on the last slide, which is on results. And so before I talk about results, we did a logical pooling of the treatment arms. We think that text messages and pre-recorded voice messages were a more impersonal method of information delivery or any kind of risk communication, and hence we pool those two and compare them with phone calls, like the impact of phone calls on information delivery and mental health. And we see that when it comes to the knowledge outcome, phone calls were marginally improving the knowledge base of our respondents. This was though, like in terms of comparing people who own smartphones versus those who didn't. People who did not own smartphones were 18% more likely to increase their knowledge base compared to people who own smartphones. For mental health, this was our study was way more impactful, and about 16% of the population showed reductions. There was 16% reduction in the mental health score. Improvement in mental health scores of our respondents when they received the information via a phone call. And we specifically saw more improvements in anxiety scores, and people suffering from severe to moderate anxiety reduced. Phone calls reduced their anxiety measures by 28%. That's about the study. I've been extremely brief, but I think we realized how important phone calls were in not just providing the information, but they have a large potential that we can tap in when it comes to risk communication, which is extremely important in these times when we're looking at large numbers of vaccine hesitancy. So GPL is trying to scale this study up and use our results for like a larger good, and Smith will take you through that.
Thanks, Ashwati. So one of the key things that we learned from the study we did with migrant workers misinformation was communication is key, and communication is key for increasing knowledge. And if it's possible to do in-person communication, it would have positive effect on mental health. So what we are at the moment doing is the main theme or main pressing issue we had in the last time in the study was people's awareness about COVID. But at this time, we have the issues related to, can we move to the next slide? Yeah, issues related to vaccines. So we did we did a small kind of just study or some survey with workers of very small number 23, and only 1/3 of these workers are open to vaccinations. They mention either their family or friends telling them that vaccines are not safe, vaccines don't work, or they can be harmful to them, right? And it's a huge concern. So what at the moment, looking at our earlier study, what we are helping to address this misinformation among workers through the firms they're employed at. So Shahi Exports is our partner for these both of these studies. So they are trying to create awareness among their workers, also through firm level vaccination, trying to get the workers vaccinated at centralized locations. So they the firm vaccinates and that too to various success. So some factories had 40, 60, 80% success rate, people taking vaccine, and some had low vaccine rate. So at the moment we are trying to scale up our study at the firm level where we can actually help them to improve vaccination rate, reduce the vaccine hesitancy. We're also trying to do this like independent of the firm, using volunteer model to make phone calls to address concerns and misinformations. And we are trying to kind of take these two approaches kind of address some of the misconception around vaccines. Thank you. Nishika, over to you.
Thanks, Smith and Sashwati. Those were some very interesting insights and extremely relevant as well. We can now move to the Q&A. And before we take some questions from our audience, there are just a few that I wanted to ask from my side. The first one being an overarching question to all the speakers. That is, given that we know that COVID-19 is a long-term problem, what are some key learnings from these two studies that you all feel development practitioners should be mindful of when they're framing evidence-based policies?
Karan, do you want to go first? Yes, I can take.
Yeah, sure. I think from our study, one of the insights that Smith talked about was this importance of more proactive and reaffirming communication, not just from the government but also from the employers around job security, around safety precautions. So one of the things that we found that a lot of these women were stressed and worried about not having enough money for their personal expenditure now, but also they wanted to not spend money because there was this great uncertainty about what will happen in the future around the same time. And and this is, by the way, a very as Smith said, it's not the informal migrant workers. These are sort of formally employed wage workers, and so if they were going through this level of stress, we can only imagine that what informal workers who form a much larger portion of the economy would have been going through. So I think just that type of more where employers can to emphasize on job prospects and job security could be valuable to give that reassurance. I pass in on to Smith if you have any further thoughts on this.
Hey, thanks, Karan. So, one of the other things I would say is kind of, I've been thinking through an economics hat of lockdowns, their impact, and preferences of individuals, and to see kind of understand where the pain points are and how do the preferences differ. So I think we have now more information than we had a year ago when we had lockdowns, and it just shows that even our priors about what worries worker, what they don't worry about, what their own concerns are. I think giving voice to them and like making sure that those preferences are taken into account uh, is very important from policy perspective. And second one is it's not making conjecture and hypothesis, but kind of basing some of the results on data and trying to have an infrastructure to kind of have that input ready when required. So that's key because a lot of this COVID related surveys were done at GBL. For example, we were able to do both these surveys because the main mental health or misinformation study is kind of study population which we are doing for a buddy system in intervention for our a trial we are running on mental health of migrant workers. The other studies population is a follow-up surveys of the study population we have for financial inclusion product, right? So we were able to repurpose some of the data we had for this study. For government level, I think a lot of researchers have been saying that, but just having that basic core infrastructure ready to have that data coming in to make better decisions is important, where kind of some of the decisions that are taken without consultation or data could be really harmful. And we have all seen how the informal migrants suffer. So I think just key insight is instead of relying on our priors, relying on data, getting real-time quick data is very important.
I would also like to add something because this was an inherent part of our study. And something really interesting that we noticed was because we controlled for the content, the length of the content delivered, or whether people were interested in repeating the information, we realized that knowledge was affected by the information specifically delivered. But for phone calls, the impact was not taken care of when we looked at just the information. So we know for a fact that there is inherently something more about this personal method of information delivery compared to for example, text messages or audio recordings, which is what is the norm right now. The government prefers to use text messages or audio recordings, and I think that's something that policymakers or even businesses who are interested in improving their risk communication or information delivery need to take into account, that they have to invest in more personal mediums of information delivery, just to ensure that one, people are more interested in the information that they're providing, and also that like it has better impacts on their mental health, as simple as that.
Yeah, that's very helpful. Thank you, everyone, for that. One more question before we take other questions from our audience. What role do you think local organizations can play in taking up the insights from this research, and how we as academia can disseminate these insights amongst a wider audience?
I can go on this again. And I think with especially the misinformation study, communities or organizations interested who are more invested in the communities, and are at the forefront, they understand the kind of misinformation that might exist. So that's extremely important, because like we as researchers need to find out the misinformation, but they're more likely to understand the population better. So in that sense, they can definitely take charge of combating misinformation directly, and knowing the fact that they have like a personal medium works, the study shows that it works. Even there are other studies, like major studies, that talk about how like a particular person of influence and when messaging is provided by somebody who's an influencer is more likely to affect. You find those nodes in your community, you make sure that you find those nodes and you use personalized methods using these nodes to provide information. And that's a very big take from and that local communities can very easily invest in something like this.
Something I would want to think more about is, I think Sunil has also mentioned this, is just knowing who the migrants are, because India has very set patterns of migrations. For example, Odisha, a lot of migrants come from Odisha to Bangalore, and a lot of government investment in skill trainings have been there. But there's a massive gap in the knowledge about the trajectory of these workers as well as how they perform, what are the problems they face. We are trying to address some of these, but it needs larger communities. So one of the key kind of things is the local communities to kind of make sure if migrants are moving away from those local communities or NGO, kind of, for example, NGOs in Odisha can actually have some set of information about who is going, and then if they come back, what their experience have been. Dissemination of that would be helpful, and even kind of just making digital networks powerful can be a tool where this can be done easily, where there is a remittance pattern which local kind of, a lot of times people go to local vendors to send money, and just having that channels mapped out better academically or kind of disseminated in local networks where they can act would be very helpful. For example, we are working on a project of migrant support centers. Government has a lot of this infrastructure, but they're not well functional. So strengthening these existing government structures with kind of making more active efforts from NGOs and employers could be very helpful.
Building off on that, I think so. And also Mr. Sunil Parak raised this point about local databases. I think one of the writings that we've been working with migrant workers, through state governments and through organizations like Indus Action and Indus Action and Haq Dakshak are doing interesting work in this space. One of the challenges we've seen is that migrants have very limited political voice in their place of where they're working, because often they're not part of the voter base, and so there is a view among state governments to think through why should we prioritize interventions for those who are not from here, right? Now of course we know that that's the wrong way to think, because migrants add a lot of value to the local economy, and given that migration can add, one of course adds adds a lot of value to the local economy, but also secondly, if we start thinking in those silos as a country, then it's going to be counterproductive. Now local organizations have a great role to play in articulating that demand. I mean, in addition to everything that Shashwati and Smith were saying, in terms when it comes to migrant rights, local organizations can do a lot, but the state can do a lot more. And I think local organizations have a lot of role to play in advocacy and lobbying with the local government, and with employers to then lobby with the local governments to do more for migrants. And some of the starting points are things like building better databases of migrant workers and making it easy for migrants to register and get benefits from the state if the benefits are due to them. A lot of the times the way governments function is that they make it, even when these systems exist, it's very onerous and very hard for actually migrant workers to register and to claim benefits. And this is really painful for them, because a lot of them live a very vulnerable existence and don't have time to waste on making multiple visits to their local municipality office to make a registration. So I think we need to make this local state realize the benefits of working with migrants, helping migrants, but also making it easier for migrants to access those registration systems and benefits that result from those.
Yeah, just to add to Karan's point, it's very important to understand that this migrants, the demand on their time. So kind of they are, for example, for our financial inclusion study we did, one of the key barriers we faced was these workers did not have their phone number registered to bank accounts. And that was one of the very key barriers. It was very hard for us to change that because these workers did not have, so they worked from Monday to Saturday and they did not have time to go to bank, as well as then to actually have know how to deal with the bank, right? So, and this is just one issue, but this applies to everything in kind of going to municipal corporation or any other stuff, right? Demanding the political rights, everything else. So this kind of, and they, many worker migrants who are single, they have this day-to-day existence where they can't like miss 3 or 4 work. The opportunity cost is very high. So just keeping that in mind when we are thinking about questions of migrant rights is very important, and where if we can build support systems to reduce this barriers, that would be key. And local organizations can play a huge role, as Karan mentioned.
Great. Thanks for that. That's very helpful. Moving on to questions from our audience. Samir says that I'm curious to understand role of employers, businesses for providing the right information. Are there any such examples where businesses came forward and reached out to their workers, especially migrants and informal workers? Sashwati Smith, do you want to take that up?
Uh, I mean, there are some evidence is there, but we, at least I am not aware of a comprehensive list. But I think it has, I think the fundamental nature of this has kind of two aspects: a moral or ethical aspects and a business relationship aspect, where a lot of businesses, there is a tremendous heterogeneity in businesses. So a lot of businesses by themselves who care for their workers, trying to kind of address as much they can. But at the point, you should also remember that business themselves are in precarious situation, because a lot of small or big businesses had a huge cash flow issue during first and second lockdown, where if your factories are locked down, you have to make salaries. Even if you don't have liquidity, even larger businesses suffer to do so you need to keep that in background. So, and the second one is business angle, where they, a lot of businesses wanted their workers back when they wanted to start off. For example, I can speak more about Shahi because I know the case quickly, because in March or April, they tried to get, like, there was a huge outcry even in Bangladesh and India, where foreign, like, in this situation, the brands who are sourcing from these countries just said no to orders. They even said no to orders which they had already placed, right? So, which were already work in progress and were produced, they said no. And out of lot of hue and cry, especially coming from Bangladesh, the brand said, oh, we'll honor all our obligations, right? So these kind of thing where there were orders to be placed, then the businesses needed workers to come back. And in that case, it became easy because it was businesses need that workers should come back, because if they had order, they needed workers to come back. So if that business need is there, then businesses were way more proactive about getting right communication, making sure workers are back, right? So we need to have both. The latter case is easier to make. First one is kind of what we are working at, would be like work businesses actually investing in workers, and that's hard to quantify, as well as hard to kind of pinpoint when businesses actually care about workers where they don't.
One silver lining in all of this is that we've seen examples of employers coming in and signing their workers up for vaccination or and making that effort. I think even though those are like Smith said, it's a lot about how much the businesses have either whether they even have the bandwidth to spend that much effort or not. But if, for example, businesses are interested in bouncing back, it is important that they take into account that they take responsibility for one, helping their workers sign up for vaccination, even provide vaccination if necessary. And I think any example of that is a good example of employers taking charge in these times. So.
Great. Another question that we have asks about can you talk about your reasoning behind conducting the study with only smartphone users as opposed to also including feature phone users? So this is for the inclusion study. Smith, Karan, do you want to take that up?
Yeah, I can quickly address that. So we feature phone users in their *9 and hash, which feature phone users can use to remit money. It just is very cumbersome and wasn't easy to use. And so our way to think about it was that, look, feature users will need a whole new set of interventions, which are more around making that product design much easier uh, and smoother to use. And so let's focus on, so that's one side of intervention. And we didn't have the skills to address that in a very fundamental way, that even if we would do all this knowledge and trust building and familiarity and practice, it wouldn't really move the needle by that much on the feature phone users using *9 and hash. With smartphone users, there was some hope. There was and that the technology itself, once you go through all those onerous steps of registering and getting your UPI ID and being able to connect it to your bank account, once you do that, your UPI ID and being able to connect it to your bank account, once you do that, then you can actually send and receive money fairly easily, and therefore that's the margin we chose to focus on. Smith, wondering if you want to add anything further to that.
Yeah, so just to give you example how why we like this, we did a lot of like 3 or 4 pilot studies with like 20 people each, and we had feature phone users. We did not have one successful transaction completion on all any of the feature phones, like not even one. Like either the message would like things would break, you have to go back. So I think the whole issue of that platform being useful is very questionable. So that's the one thing. And the second point, what we know from now from the baseline study is, even though these workers don't use digital remittances or digital payments, almost 80 to 90% of them use WhatsApp or other form, like they use YouTube for showing videos. So it's not like they are not just completely digitally illiterate. So they use some forms when they need, but they're not using this one. So that's why we thought this is margin where we can actually have some impact.
Great. And another question for the two of you, Smith and Karan. What are some things that private sector organizations should keep in mind while designing inclusive digital payment solutions?
Smith, you want to start?
Yeah, I think key aspect is some, I think making it easier to work is key. I mean, it's for all product design, but for this specifically, there needs to be two aspects. One is kind of understanding the other barriers these people face, right? So a lot of times these people don't have space on their app, right? And that just makes it hard to kind of download a new app, or they don't have balance to send even the SMS that is required for verification. So these small things, they just add up, as Karan said, right? So just that part is very important, where even small things which we think assume can become a barrier. And the second one is training. Role of training is important because a lot of people knew this exists, but they didn't know. So if even like the people who can be self-taught or learn with digital literacy are, there's a huge chunk in India given our population who can do that, but there's other spectrum where people, you need to invest in training of these workers and making like hand holding key. Employer can make it part of their inductions, training centers can make it part of their curriculum, where you need repeated interactions. You have repeated interactions with these workers or this segment, and then it would be done. But I think it would be hard to kind of get this across without hand holding. We do have some evidence, for example, in Africa, like Kenya, in Africa, it's great example where like the mobile digital M-Pesa has been like 80-85% people using it, right? Big part of their economy. So I see there's hope, but due to what we have, we need these kind of intervention going together to make it happen. Correct?
Amazing. Another question on remittance behavior. Um, it says, have there been insights on how behaviors or patterns of remittance behaviors changed over the past 1.5 years during the pandemic? What do you predict to happen over the coming months or years? That's an interesting one.
That's a very very broad question. So it's hard for us to predict, but I think a fundamental level kind of uh, issue has been like a lot of, for at least the sector we are working, the migrant workers, they come to work in garment factory with the biggest motive of sending money, right? So just to give you context, these workers, if they earn 9,000, they're sending 4 to 5,000 home. That's huge proportional chunk goes back to their families. And the pattern usually is on 7th of the month, they get their salary. In the first week, they would take out the money and send this big chunk to their families, right? So that's very important for this migrant workers. and this specific set of things. You see same evidence, I think, having international like economies which rely on remittances actually had macroeconomic shocks because remittances dried up, right? Like I think Pakistan was an example, early case where remittances dried up and they were just struggling to keep up, right? So we hope, I think that the question is how quickly economy normalizes, and that would in our study we just finished in June, so we do see a upward trend in the remittances. And I think the issue is, I think it's closely linked with economy, but we do see the as more the uncertainty, less would be people's tendency to remit and save more. Karan?
Yeah, agree with all that. And I think, but holding those things constant, I think, even in our study, we have some seeds of finding that, remittances, amongst those who were using digital remittance, they were able to send more money home. And I think the way to think about it is theoretically is that, there's all these barriers to using digital payment channels, and there are these potential benefits of using them. And so a lot of the workers perceive those barriers as being much larger than the benefits. Once the lockdown hits, and once, some of those alternatives that they were using to send money home closed down, then the even though the barriers remain the same for digital payment methods, remittance methods, the perceived benefits are higher, because now this is one of the few ways to actually be able to send money home. And so theoretically we would expect that, given the constraints, that would force I would get more people to start using these digital payment channels. But I don't know if I'm aware of any particular. I mean, there are aggregate industry trends that, lots more people are using digital payment channels. Much more e-commerce, but can't speak conclusively about that from our own work.
Yeah, for example, there is some growth. So for example, we do see from February to April to June. So the number of people have gone couple of percentage points using digital remittances. So April we see 16 to 17 percentage people overall using digital payments. That went to 18-19% till June. So there is some organic learning there, but that's still small.
Great, that's very helpful. The next question is for Smith and Sashwati. It's from YouTube from Nirupama. She says that startups such as Zomato seem to be doing well vaccinating their workers, even though they are gig workers. So, isn't providing vaccination to workers more effective than just creating awareness?
For sure, the issue is, would workers take the vaccine, right? So I don't think they are either or. Like, so I think we need getting work, because there are two aspects, right? One is whether employer are able to provide vaccination to all, or would we rely on other source where we expect workers to go and get vaccines from other sources, like so government hospital, private hospital. So in that case, in if that is the case, the information is important, because workers can refuse to take vaccination, and that we have seen a lot. So employer, if they can get through economic scale vaccine, that's great, or they rely on workers. But then even if they do everything, workers can still say no to vaccines, right? So it's important for awareness for workers willingness to take vaccine. So I think we cannot substitute any, and depending on how big the employer is, they need to do both, or at least awareness.
Sashwati, do you want to add to that?
No, I think that's like the perfect answer. We know for a fact that vaccination and hesitancy around vaccination is a very big issue. So just providing the vaccines aren't enough, like Smith said.
Another question that we have from YouTube for the two of you, Smith and Sashwati, is do we know if text messages and voice recorded calls have any impact on knowledge or mental health?
I can take this one, Smith. So, because of ethical issues, we do not have a pure control group in our study. We do not check the effect, hence, we do not check the effect of just providing text messages or just providing phone call records, recorded phone calls to people on their mental health and knowledge. Just because if we're, I mean, I just hope everyone understands why we did not have a pure control group, but hence we only have a comparative, impact rate of like what the effect of phone calls were, and we don't have it. But I think just knowing the fact that text messages and phone call recordings are the norm, I think our study does add, an additional layer to what's the norm already.
Great. That was helpful. I'm just gonna check with our audience if there are any more questions that they'd like us to answer at this point. Okay, great. Perhaps you all can share some closing remarks, some valuable insights that you would want our audience to think about.
I can just urge everyone to read the paper. It's a very short research paper, which is a great thing because makes it more accessible compared to larger research papers like lengthier ones. So I would urge everyone to take some time out of their schedules and maybe read out the paper because it's very interesting, very lucidly written. Great job by Sadish and Achananand on writing this paper. So.
My final thoughts are around the fact that migrants are a very important component for the lifeblood of our society and economy, and I think the understanding of how migrants work and how they their working conditions and the decisions they take and how they take those decisions is very important to understand how to improve their lives and the lives of others around them in urban areas. And so, as India grows over the next few years and decades, migration will become even more pressing. And I think it's been a very neglected topic, both in research and policy, as we saw last year. In the face of the first lockdown. And so, I think, uh, it's good that we are beginning to sort of invest in understanding that more and helping migrants. And I think a lot more of an effort will be required uh, to ensure that internal migration in India is as smooth and as beneficial a process for both the migrants themselves and the places where they live and the places that they go to. Smith, final thoughts to you. Over to you.
I think with all these studies, I think just more investment in gathering data and tracking migrants would be very important.
Great.
Yeah.
A big thank you to all our speakers for such an informative session. Thank you to everyone who joined and who stayed on here with us till the very end. It was a great discussion, and we sincerely hope that you're at least taking one valuable insight from this webinar. I'd also like to quickly mention that we just launched our new thought leadership platform, which is GBL Access, as part of which we're having discussions with key thought leaders in the space and sharing those insights on our social media platforms. You can check out the insights on different platforms. And in fact, we just launched an interview with Divya Nair, who is a co-team member at ID Insight. So do check that out on our YouTube. And also, please feel free to reach out to us at info@goodbusinesslab.org with any questions, suggestions, or opportunities. We'd love to have a conversation, even just beyond the scope of this webinar. In the end, I'd also like to thank everyone from the GBL team who has been working behind the scenes to make sure that everything goes on smoothly. I'd just like to give a special shout out to Ankita, Shalin, Lavanya, Nirupama, Mansi, and everyone else. Thank you so much, and we hope to see you next year.
Thanks, everyone.
Thanks, everyone.